WCNC Charlotte. This is Flashpoint, where power and politics collide and the tough questions get asked and answered.
Thanks for joining us here on Flashpoint. I'm Ben Thompson. This week, finally, goodbye mask mandates. Mecklenburg County officially lifting the order next Saturday. It comes after the health director, Dr. Raynard Washington's recommendations, citing 4 different metrics: shifting COVID conditions, higher community immunity, stabilized hospitalizations, and a general lack of enforcement. The County Commission meeting this past week was where the decision was made. It was packed with people. Lots of folks had signs, as you see there, asking county leaders to finally get rid of this thing. They also filled the public comment time. There were people, though, who wanted the mandate to stay in place.
To be blunt, no one sitting in an office should be making a decision for my child unless they are putting boots on the ground to see what is happening.
We all are tired of wearing a mask. Nobody thinks this is the best thing or a great thing, but we make the decision to wear it because we think it's the better decision for the larger community.
Proving good people can disagree. I think most people could hear those 2 sound bites and say they both make sense to a certain extent. But why the change in masks now? Ultimately, the health director argued cases and hospitalizations are both down, and cloth masks honestly just have not been effective against Omicron. There's also a higher level of immunity now throughout the county, thanks to vaccines and the fact that a lot of people have, at this point, gotten the virus. Joining us today, new Mecklenburg County Health Director, Dr. Raynard Washington. Doctor, thanks for coming on. We appreciate it.
My pleasure.
So last time I looked, our percent positive rate here in Mecklenburg County was right around 14.5%. That is a long way off from the 5% threshold we were saying for a long time that we needed to get below in order to drop the mask mandate. So give us an idea, what exactly has changed?
Sure. There are a number of aspects or a number of components of our conditions here in the community that have changed over the course of the last several months. Specifically, I will first point to, obviously, that we are at a level of community immunity that I think is given the greater transmissibility of Omicron and the large number of our residents who were infected. Certainly, I think that is an important aspect of where we are today. As I mentioned in my comments earlier this week, we are also growing increasingly concerned about the reliability of percent positivity as a metric to be able to help us understand the full totality of what's happening in terms of community transmission here. That's mostly because we as public health agencies are going to be increasingly challenged to be able to count every case of COVID in the community. That is mostly because of the wide availability of rapid at-home test kits in the community. We do have a large number of those available. We are not able to count those at this time. And so that metric, percent positivity, we've started to see a very clear divergence from it and our case rates and other important indicators in our tracking.
So that metric, percent positivity, what we used for the better part of the last 2 years for most of the pandemic, because of at-home tests and various other reasons, community immunity just isn't quite as useful as it once was.
Certainly, and I'm confident that we are on the other side of our Omicron surge here. Our experience was very similar to other countries and cities and states that were a little bit ahead of us in that surge. And so certainly, I believe that now is a good time for us to begin this transition to what I've phrased as COVID response 2.0, but to begin to off-ramp some of these response measures and really focus our response again on the most vulnerable in our community, as well as to empower the community to be able to act with the resources that we have available to help us manage COVID for the long term.
As you know, we've been down this road before, lifting a mask mandate only to reinstate it. Given some of the reasons you just gave us, the vaccinations, community spread, but also a lack of enforcement, and as we saw in Omicron, face masks were honestly just not cutting it. Do you see an instance or a scenario in which we go back to masking mandates?
Sure. So I don't have a crystal ball. I don't know what the future holds for sure. Coronaviruses are very fragile and mutate a lot, which is certainly concerning for us. And there are a number of pathways that might happen as it relates to what endemic COVID-19 looks like. And so I think that is yet to be determined and yet to be seen at this time. I'm certain that we'll continue to have some additional surges in the future. I don't know what they'll look like because I don't know what the mutations and what the consequence of those mutations will be. So I can't say definitively that there won't be a time where we as a community may need to implement measures across the community, community-wide measures. But I do believe that we do have to transition to drive our decision-making about those measures based on the severity of impact on our community as opposed to simply counting cases. It is important for us to understand sort of what impact it's having on severe illness. Are people sicker? Are people dying more frequently? As well as the capacity of our important systems like our healthcare systems, our emergency management systems, if they're able to sustain their operations to be able to provide critical healthcare services. Those really need to be sort of the focal points of us triggering sort of, do we need to implement additional community-wide mitigation measures, like, for example, a mask mandate. I do know for sure that we will make advisories at periods when we do start to see upward trending in any of our indicators to the public, to let them know that now is a time, particularly those who are more vulnerable, to put those masks on, and particularly look for those higher quality masks to ensure you're protecting yourself.
Still, I would say advisories are a little different. I just want to be clear for the folks at home. So I want to set people up at home for proper expectations. You're expecting there's probably going to be more surges again at some point down the road. You're expecting there's going to be other variants again, whether it's 5 months from now or a year from now. But the public health response is going to be a bit different. That's what you're saying.
Yes, sir. Exactly. And we've got to start to turn that corner as a community, as a country, really. And I believe we'll hear more from our other partners about what that transition looks like as a nation. For businesses out there, they can still enforce their own private business mask mandate if they want, correct? Yes, that is correct. Businesses and other entities, just like CMS, are able to implement or enforce mask wearing requirements in their establishments as they see fit. We did a piece this week on Wake Up Charlotte about one-way masking. Basically, that's the idea of, even though these mandates are lifting, if you are immunocompromised or if you're just not quite comfortable going into public settings, you can still wear a really good, well-fitted N95, KN95 mask, and it actually is quite effective. Based on what you know, does one-way masking, is that really that helpful? Absolutely. I think there's clear evidence that individuals that particularly the higher quality masks that you just described, especially if it's well fitting, do offer great high level of protection for individuals who are vulnerable to protect them against infection. That's important, as well as making sure people are up to date with their vaccines. And I think that is a central part of our response or our transition, is really focusing in completely on vaccines and making sure that everyone in our community has all the information that they need relative to being up to date and have access and availability to do so. You said at the commission meeting this past week, we're going to have to just learn to adapt and adjust to live with it. Is that your message to the folks at home that hey, this is not going anywhere. This is endemic. This is not going anywhere. But perhaps we take a more nuanced, measured approach to it? Yeah, and I think certainly, our community has been, our country, our world has been dealing with COVID for 2 years, and we really have been in what I would describe as an emergency response mode. And I believe this is a good pivot for us to begin to really look at what managing COVID on a long-term sustainable basis looks like in the community. And certainly for folks, we'll have to make decisions about what their own risk is. We'll have to access resources. We're going to do our job to make sure those resources are well available in the community at no cost to all of our residents, and make sure that individuals take those, again, multiple layers of protection to ensure that they are protected from severe illness and any severe consequences of COVID. And that does include masking, that includes vaccination, that also includes testing and staying home if you're sick, and avoiding contact with other people, as well as self-contact tracing. If you have COVID, even if you diagnosed on a home test, make sure you tell those that you were around so they also can take those measures themselves. Coming up after the break, one of the most taboo of topics and how this pandemic has impacted it here in Charlotte.